Hello, Lisa Broyles with Way to Health MD. This video was requested by some of my members for my opinion on ivermectin and its uses. So ivermectin has been hotly debated since the COVID outbreak of 2019 through 2021, and I wanted to give you some of the facts and my clinical experience. So first of all, ivermectin does have unrefuted therapeutic evidence against parasites and as an antifungal. So it's long been used against malaria and as an antiparasitic against different types of worms in humans as well as animals. So that really isn't contested. What really has been contested is, does it have antiviral properties, anti-inflammatory properties? Could it even be a treatment for cancer? So that's what I want to address in this video. So I have included a link to some studies on ivermectin's use. We'll just go ahead and address COVID. So what I can tell from the literature is that if ivermectin is given at 0.2 milligram per kilogram dose, typically that dose is divided into 2 doses during the day. So basically, if that dose is given for 5 days before someone gets COVID, it helps prevent them from getting COVID if they were exposed to it while traveling or from a loved one. So a good use for ivermectin for COVID would be if a family member just came down with COVID and you're worried about getting it, that's a great time to take ivermectin prophylactically at the 0.2 milligram per kilogram dose. So typically for most adults that would range in the 11 to 15 milligrams dose, and you take that twice a day for 5 days. I have to get this compounded. So any of my patients that would like a prescription for it, for this prophylactic use, I can get that from Shelton Compounding Pharmacy in Hendersonville, North Carolina. There are limited pharmacies that are willing to prescribe or dispense ivermectin due to all the controversy and medical boards threatening physicians' licenses because of its use. So large studies have been done to look at ivermectin's efficacy for preventing death from COVID or reducing hospital stays. And unfortunately, that data really hasn't panned out. There's been multiple studies that showed that in Malaysia and Brazil, patients that had COVID already for a week to see if they could prevent hospitalization, and the hospitalization and death rate was actually the same. It was not statistically significant for the ones that received ivermectin and the ones that did not. Upon further analysis of these studies, however, 2 things were important to me. One, the ivermectin was not started in the majority of cases until about a week into the illness. This is already too late. The way antivirals, including ivermectin, works is that it blocks the virus's ability to invade your cells and force your cells to make more of the virus. So ivermectin works early. You catch it right when you get sick, like the first day or 2 right at exposure. That's when ivermectin really shines. It prevents the virus from entering your cells and replicating itself and turning your body into a COVID factory, okay? Unfortunately, the patients in these studies were either given a suboptimal dose or given a dose once a day for only 3 days, as in the case of the Brazilian study by Reese and Silva, or they were given the medication too late at a week after the illness had already been there. So COVID has already replicated itself for a whole week. So yes, at that point, no antiviral really makes much of a difference. So it does have antiviral properties for prophylaxis and if caught at the very beginning of infection. Okay, there also have been some good studies showing that ivermectin has anti-inflammatory properties, so possibly can be used to reduce an asthma flare. I have included a study on that as well. There are some studies that are in the works as far as if it can prevent cancer. I can't speak to that as there's no studies that have been done yet to prove that. It also has no antibacterial properties. There's also been some benefit for rosacea and for fungal infections. So I have included some studies to prove its efficacy for rosacea, for early stage COVID, and for antifungal infections, and the already known uses for malaria and parasites. What it does not work against is bacteria. It may reduce an asthma flare, and so far the studies are unknown as far as its benefit for cancer. So I hope that review is helpful for you on ivermectin's use, and please don't buy ivermectin that's meant for your horse and take it yourself, as it has not been created in a sterile environment for humans. Please reach out to me or another provider that would prescribe the ivermectin to get it through a compounding pharmacy, and we're happy to help you. The most common side effect is diarrhea and stomach upset. I personally have taken ivermectin while I've been traveling or when I've come home and started to have COVID-like symptoms, and my symptoms were gone within 2 days of taking the ivermectin. I have also had a little bit of an upset stomach with each time I've taken it. So I hope that information is useful. Thank you.